So my ultimate purpose in life is to impact billions of lives, right? However I can do so.
Today, I had a great conversation with Dr. Sachin Maskey. Talk about a man with vision, already making a huge impact, but his vision for the future is even bigger. Sachin immigrated to the United States from Nepal to escape the guerrilla war in 2006. He had no place to live, no friends, and only $2,000 in his pocket. He worked hard, and now he's living the American dream. He's a physician who built his own medical practice and started a real estate investment company. He's also a #1 best-selling author on Amazon and host of the Dream Big and Think Different podcast. In 2019, a deeply impactful encounter led him to want to help people who don't share the life he has here in the United States, people he grew up with in Nepal. That's when Sachin and his wife started the Donna Yoga Foundation. They didn't waste any time helping people get access to education and healthcare. They're currently working toward building the world's largest diabetes center in Nepal. Sachin is an inspiring guy, someone who really takes life by the horns. I'm so grateful for the opportunity to welcome you to my conversation with Dr. Sachin Maskey. How involved is your family in this whole thing?
That's a great question. So I have two kids. My son is 13 and my daughter is turned 9 recently, actually. Surprisingly, you cannot believe this, but when I started talking about, in my breakfast, and we talk about this nonprofit and the things that gives me this energy to do what I am doing, other things, and they're pretty involved, honestly speaking. We had this gala dinner recently, May 4th, and my daughter, she's just 9, but she is participating on in terms of, like, giving back, kind of like, she was in the stage, and we had a lot of other kids also involved, singing a national anthem, those kind of thing. And my son actually played a instrument called sarangi in front of like 150 people, and they're pretty involved. And surprisingly, we made a video back in 2 years ago, like a live. It was a live video, and then I was mentioning about I'm president of Danna Yoga Foundation, and guess what my daughter said. It was like so funny that she said, I'm a vice president of nonprofit.
Good for her, yeah.
She will be, eventually, but that
That's
was so
good.
funny.
But you're instilling that early in her and I guess in both the kids, really, right?
Absolutely, absolutely. Giving back is something we all need to strive in, and because this is our life, that we are basically serving others, right? So yeah, absolutely.
Today, I had a great conversation with Dr. Sachin Maskey. Talk about a man with vision, already making a huge impact, but his vision for the future is even bigger. Sachin immigrated to the United States from Nepal to escape the guerrilla war in 2006. He had no place to live, no friends, and only $2,000 in his pocket. He worked hard, and now he's living the American dream. He's a physician who built his own medical practice and started a real estate investment company. He's also a #1 best-selling author on Amazon and host of the Dream Big and Think Different podcast. In 2019, a deeply impactful encounter led him to want to help people who don't share the life he has here in the United States, people he grew up with in Nepal. That's when Sachin and his wife started the Donna Yoga Foundation. They didn't waste any time helping people get access to education and healthcare. They're currently working toward building the world's largest diabetes center in Nepal. Sachin is an inspiring guy, someone who really takes life by the horns. I'm so grateful for the opportunity to welcome you to my conversation with Dr. Sachin Maskey. Now, this is your native Nepal that you're choosing to serve through the foundation, through everything you're doing. Why Nepal? Why not focus on your immediate community? Why not anywhere else in the world? And with all your gifts and talents, why did you choose this specific mission?
Absolutely. So I was born and raised in Nepal, spent my life 26 years, and I guess why Nepal was, I mean, honestly speaking, we're kind of expanding to other countries too, especially India will be our neighboring country. And also we're going to I don't know, I told you this, but we're going to Africa
No, you didn't.
and
That's
also in
great.
Pakistan. So those are the four countries right now we're focusing, but definitely Nepal because that's my birthplace. And number two, I found this person called Olga Murray. She's American. She's a U.S. citizen, and the reason I founded my nonprofit was because of her things she was doing. I really was inspired, and she was a lawyer by profession. She went to Nepal when she was 65. Guess what? And when I met her, she was 93, and I was like, "Oh my God!" She's 93 years old, and she's doing such amazing work. And I'm from Nepal. I'm a doctor. I need to do something, so that's one of the reasons. So I mean, Nepal as also, it's a one of the beautiful country in the world. I talk about two things in Nepal. One is Mount Everest, which is highest peak in the world.
Hmm.
Number two is a Gautam Buddha, which is Buddha was born in Nepal. So so Nepal has, even though it's a beautiful country, naturally gifted, but there is a lot of poverty there and a lot of need there, especially in health and education sector.
Hmm.
And I can go more, but that's a high level view.
That's a great segue, though. So tell me a little bit more about the Donna Yoga Foundation. You guys have three areas of emphasis that you're primarily focused on. Tell me about each of those three areas in a little bit of detail from your eyes.
Absolutely. So we started this organization in 2018. It's 501c3, a nonprofit organization based in Massachusetts. So we have three core programs. Our mission is wealth and prosperity for everyone by improving two things: health and education. So in the health sector, the ultimate goal is to build hospitals, especially focus on diabetes care around the world. And then education, we are trying to help people with the blinds and orphans. We're building a school, so hospital and the school. The Donna Yoga Foundation, the Donna stands for, my mom first name is Dan, and my dad first name is Yog. So Dana means wealth, and yoga means prosperity. By For all, wealth and prosperity for everyone by improving, again, two things: health and education.
Hmm.
And that's our mission statement. And the three core programs Matt was asking me was what we're doing right now in Nepal, and guess what? We're doing in Boston too, in here in the
Are you
United States.
really? Wow.
Cure, yes, Cure Diabetes is gonna come here this year,
Wow,
Boston. So we're
congrats.
working on. So actually, yeah, absolutely, and we're collaborating with Harvard, Cambridge Health Alliance, and hopefully we can help people here in the United States too, especially refugee. People don't have insurance. I will be personally involved, and my wife will be involved too. So three core programs. Again, I want to go back to that. Cure Diabetes is one of them. Basically what we do is we go to the remote area of Nepal, the where you'll be surprised to hear this. Here in the United States, we when you want to see a doctor, you have a lot of option, right? You go walk
Hmm.
in, you go to emergency, you have your primary care, whatever. In Nepal, just to see a doctor in a remote area, first of all, they don't have a hospital, they don't have any clinics, they don't have anything, so they'll have to walk by foot 2 hours to see a doctor, like a couple of hours. So we go to these areas where there's no access to the care, and then we do like a 2 or 3 days, depending upon the location, a massive screening for people who have diabetes, and also distribute some free distribution of the, it could be medication, eye drops, list goes on. But we focus on diabetes because that's our mission, to establish a diabetes care. So last year we did one. We went to a remote area of Nepal. It takes about 3 hours to go there, and there were about 1,000 people in one day. Like we screen with diabetes and eye care, dental care. So all about screening, education, promoting, the basic, like education awareness. What is diabetes? Like simple thing, like what affects diabetes, how you can prevent diabetes, simple lifestyle changes, those kind of things.
And how many people
That's
did you
our
say in
core
one
cure.
day?
That time I believe it was 1,000
My word.
approximately. Yeah, it
Yep.
was a, yeah. So yeah, so that's one. And number two, we do cure a blindness. This is especially focused on cataract surgery, and this is also fascinating to let a listener know about. This is like um, just imagine with this is very impactful. With less than $50, on less than 15 minutes, you can give somebody vision to see the world.
Hmm.
That's significantly impactful, right? So somebody cannot see blind with cataract, and we spend like $50 to $100 depending upon the location and all that, but roughly it's $50 to $100. It's like one dinner for us, right? You're impacting that person's lives forever, not for them, for their family, everybody.
Oh, no kidding.
And we've been doing this for a couple of years, yeah. We did the last year 300 cataract surgery in Nepal, and it was amazing. And we're doing this year also, roughly same amount, 300 to 500. And then the last program, so that's two. The last one is a scholarship program, and we focus on only two different special children. One is orphans, and the another one is blind. And to me, the reason I started this is because I'm from the hometown called Dharan, where was born and raised. And my mom, my brother, actually, we have three brothers. One of my brother passed away,
Hmm.
unfortunately, when he was 21. And then she started doing this, contribution to these children in Nepal. In Saraswati Bal Ashram is the name in Dharan. And I was like, why my mom was trying to help them. And I went to the school myself, the orphan kids, and then looking at them like, they're just the children, right? And my mission was to grip in the hope. Each and every kids in anywhere in the world, have needs to have a hope and dreams.
Hmm.
I wanted them to be a doctor like myself, entrepreneur, singer, or whatever they want to be, right? Sky's the limit. So, and I went there and felt so, and I saw the situation how they were living. It was pretty like, and when we live here, we have air condition, we have a nice car, we have everything God has given to us. But there, small things. They're still happy, by the way. That's like, they're smiling, their energy and all that. It's colorful, but they're like, very. I thought I need to help them in terms of education. And guess what? Less than $1 and less than $300, you can support their education for one kid for a whole year for $300. And I was like, I need to do this. So we started supporting 10 kids initially. Now we're supporting almost, I don't know, 40 kids now. So we're going every year more and more. And other children, I forgot to mention, it was a blind school. And guess what? I'm blind, and the children are like completely visually impaired. And I thought like we should help them. So those are three programs.
That's amazing. So you can give somebody sight for the first time in their life and for the rest of their life for under $100 in 15 minutes of their time.
Absolutely, absolutely. So these are the common cause of blindness in Nepal. There are other causes, but cataract, which is a reversible blindness, people
Hmm.
get like sometimes ask me this question: how can you cure blind? I mean, you can, but depending on what's caused the blinds, is a cataract is a common cause of blind. Somehow in Nepal there are a lot of cataracts, and yes, you can spend less than $100, less than 15 minutes, you can impact that person's lives.
And how are you doing this with between the diabetes treatment and the cataract surgery? Of course, with the education as well. Your education is a different beast because that's a full year commitment. You actually have to have a staff member or somebody committed for an entire year for that. But for these other two, I presume that you are not doing all of the medical side yourself. You're not performing all of these procedures yourself. Do you have a team of volunteers, or are you hiring staff local? Are you bringing people from the states? How are you
Well,
doing that?
so absolutely, absolutely. I wanted to do, I guess not myself, but I wanted to take a team of people from US. If somebody's listening to this, want to go to Nepal, I'll be happy to, coordinate that thing. But I'm actually planning something down in the road in 2025 if everything goes well. But for cure diabetes, it's a team of doctor. It's a endocrinologist, which is a diabetic specialist or primary care. Then we're gonna have a dentist, which is gonna check their mouth and make sure that oral hygienes and all
Hmm.
that. And then we have a nutritionist. We can talk about nutrition and all that. We also have ophthalmologist, the eye doctor, who's going to screen for cataract and diabetic retinopathy, which is a complication of diabetes. That's a separate cure diabetes whole, which we're gonna do in Boston this year. And then the cure blindness, which is a separate program, which we target only cataracts, to prevent, like, to help them to see the world, as I said before. So we have a team there too, mostly ophthalmologists, We partner with local organization in Nepal. So we have a Nepal sister organization called Danna Yoga Foundation in Nepal, where we have a full time staff there who helps to organize these medical camps, and it's a year long process. There's a lot of approvals you have to get it from, health authority, social welfare council. There's a process. It takes a lot of time and commitment and process. We just cannot just give money there without having the proposal, team ready. Everything has to be in process.
Well, it does take a lot of time and a lot of coordination and organization. And you've got a lot on your plate right now between all the things that you're involved in. So, how do you feel like, because the foundation itself is its own business. So, how do you feel like your other
Yes.
business ventures and establishing your medical facility and the medical practice, how has all of that benefited the foundation?
I mean, so everything I do. So I have a podcast too, by the way, Dream Big and Think Different. And I guess I wrote a book. I don't know. I told you this, but this is the book I wrote.
Amazon number one bestseller,
Precision
right?
Driven. Yes, yes. And then I also have a private equity firm. We're doing a big opportunity here, Green Affordable Wellness Community. So I have a lot in the plate, but what I do is my number one thing. Why I do what I do and why I think this is important, right? So my ultimate purpose in life is to impact billions of lives, right? However I can do. So I thought of building a hospital and school is going to do it because, guess what? The hospital, if I build like in India itself, is like 100 million people just with diabetes, 100 million.
Mm-hmm.
So, reason I wake up every day to answer a question, how like everything is geared towards this two mission: building hospital and school. So I think it's all integrated to me, So I don't think everything like for us. My wife was funny, like she told we have a third child, well, two kids, but number three is our nonprofit. so so basically, that's what we think. And we had a sixth birthday of our child this year, and we celebrated 150 people came together in Massachusetts supporting for the cause, and I was super excited. Next year we're going to do another one, gala dinner, and you're invited too.
That sounds awesome. And it sounds like it was an awesome event this year. So, one of the things that you've done that a lot of foundations don't do is you're bringing in outside support through the gala and through taking in outside donations too. How has that impacted and enabled you to do more?
Yeah, this year was our first time doing in-person gala, but last year, a couple of years, it was mostly personal donation and people I connected with, like my mentors or my organization where I work. They have been supporting us for a long time, and I guess the challenge was always in any business is capital team, and those are two, right? So yeah, so all these people who came together, not only bringing their money, but they're bringing their connection,
Yes.
their time, and guess what? We hired a new executive director. He's from Nepal. He's in Harvard right now,
Congratulations.
and he yes, and he's doing a global and social medicine in Harvard, and he's working with us now. And once it's been only 3 weeks, I guess, 2 or 3 weeks, but he's taking this to the next level of how governance, founding like forming the team and operational thing. And I'm trying to stay a little bit back because I want to do some projects here in United States, so that we can, once we make some profit, we can contribute to this cause.
That's tremendous. You know, but
Yeah.
that's kind of in your nature. I didn't realize you had hired an executive director. That's a huge next step. But then,
Yeah.
so, but you do you dream big, you think differently, just like your podcast and just like everything you talk about on it. But I can't get over your vision of the diabetes centers that you want to create, and specifically the world's largest diabetes center in Nepal.
Hmm.
I there's so many things I'd like to touch on with you because I know that your mind is always
Sure.
going in this area, but diabetes is a growing problem in that area of the world, and you've mentioned specifically in Nepal. So, what is your vision, and why do you want to put so much effort in that direction?
Sure, that's a very good question. So diabetes, let's talk about that. So it's a fifth leading cause of death in the whole world. There's about almost half a billion people in this world has diabetes, and that's the number diagnosed, right? And just in US it's 100 million
Mm.
pre-diabetes. It's mind blowing. And next 20 years is going to be billion diagnosed. There'll be like half of, I believe there's going to be a lot of people. And the sad part is 9 out of 10 people, that 100 million, doesn't know they have a pre-diabetes, right? It's a very, so it's a lot of, like a big, massive problem. And the good news is you can prevent, also reverse diabetes with simple lifestyle changes. And I call it four, six pillars now. One is food, and definitely something we all have sometimes, birthdays and all those things. Food, exercise, I call it stress, quality of sleep, and then social connections and substance use. Those are six pillars, I talk about. So reason I want to work on diabetes is a massive problem. It's growing, and if somebody is not gonna do like something about it, and it's gonna be a massive problem. So
Hmm.
that's what I believe we should step in, and together we can do a lot of things.
And are you able to find long-term solutions? Do you see a time when you're going to have full-time staff over there where you can help create these preventative elements to it as well?
Well, yeah, absolutely, absolutely. So we are focusing three verticals. So number one is patient care. So that the patient care itself includes prevention, treatment, diagnosis, and then also prevention of complication, because diabetes affects your eyes, your kidney. Those are two main organs, and we don't want complication with diabetes. It's very, very bad when you go to that, like when you have a complication. Guess what? In US, you'll be surprised to hear this. I have a lot of patients who need kidney transplant, and guess what? How many years they're waiting for the
Hmm.
kidney transplant? Minimum 10
My
years.
word.
Yeah, and then it's very bad. They have to go to dialysis every 3 times a week, and we don't want patients to have kidney failure, right? So
Hmm.
diabetes is one of the number one cause causing that. So so the prevention, we have the patient care again, prevention, treatment, and the complication. That's going to be our number one vertical. Number two, education. So we want to train our doctors, nurses, staff, everybody who's involved in patient care, including patient. We want to do educational vertical so that we can train a doctor that can come to the US, get the training, or we can bring somebody from the US to Nepal and do cross training. We are still working on logistic and everything, but that's our goal. Maybe we're going to do first seminar this year in Nepal, somehow virtually. We're trying to figure out, but that's number two. Number three, and this would be exciting one, research.
Hmm.
That's the reason for research is because everyone is different. You are different. I am different. Everyone in the world has a different, like it's called precision medicine or personalized medicine, and we want to figure out with the research how we can help each and every individual, which is unique, and that's my long-term goal. But we're going to start something most likely this year alone. Honestly speaking, we're actually meeting with the Nepal diplomats next week. Who's in here in coming? They came to Chicago, and I'm already setting up the meeting with them. And they're the head of research center in Nepal. We're trying to collaborate with them how we can do this together. In all medical school in Nepal.
That's amazing. So, when this is all said and done, what do you hope is yours and your family's legacy when you're long gone and generations down the road?
So yeah, that's one of the reason I started this, mission to build hospitals and schools. The reason is, guess what? We all came with nothing, with basically nothing, right? And we're
Mhm.
gonna gonna go with basically nothing. And so my goal is to make an impact with the hospital and the school. I'm hoping the hospitals which we're gonna build gonna impact again billions of lives, and we'll be here like I don't know, generation to generation.
Mhm.
And we're gonna have a self-sustainable model, meaning you don't want to keep on like pumping the capital to all this project, which we're gonna do initially in seed phase, but we want to run this hospital in such a way that's self-sustaining, meaning you don't need more capital.
Mhm.
We're gonna have to model. It's challenging, especially in third world or developing country like Nepal and India, because everyone has to pay cash. right? There is no insurance, unfortunately. Most of them are they are still working on the insurance policy and all that, but it's a very, very primitive phase right now. But yeah, it's a challenging thing to do. Again, it's a lot of work, a lot of team people. It's a big project. But I mean, to me, it's like whatever your mind can conceive and believe, mind can achieve. And then that's what I'm heading towards this mission, which hopefully in next 10 years will have a massive impact.
It sounds like you will. And if there's anybody who's well equipped to do this kind of thing, it is definitely you. Sachin, thank you so much for taking this time
Thank
with
you.
me, sharing your mission, your vision, and everything that you hope to accomplish in the future, and wish you all the best.
Thank you so much. It was amazing talking to you, and let's collaborate together. And thank you so much, everyone. Listen.
You bet. Take care.
Thank you.